Hi, my name is Ilanan Fatima Rizma, and today I'm going to tackle about the leukemia. Leukemia is a cancer of the blood and bone marrow. In simple terms, cancer is defined as the uncontrolled growth of abnormal cells. Cancer can develop anywhere in the body. In leukemia, this rapid out-of-control growth of abnormal cells takes place in the bone marrow of bones. So, ang leukemia is a type siya ng cancer in the blood, kung saan sa bone marrow, which is yung bone marrow yung nagpo-produce ng RBC sa isang tao. So, in simple terms, isa siyang yung cancer is nadidefine siya na bilang uncontrolled growth. Hindi nako-control yung mga abnormal cells na nag-grow sa bone marrow. So, nade-develop siya sa lahat ng parte ng katawan, yung leukemia. So, bale, isa siyang mabilis yung rapid yung pagiging control growth ng isang abnormal cells kung sa bone marrow or sa bones. So ang leukemia, the leukemias are common classified to the stem cells lines involved, either lymphoid or referring to the stem cells that produce lymphocytes, or myeloid, referring to the stem cells that produce non-lymphoid blood cells. They are also classified as either acute or chronic based on the time it takes for symptoms to evolve and the phase of the cell develop that is halted. So, ang leukemia is common siya, naka-classified siya as either lymphoid siya or myeloid. Ang lymphoid is nagre-refer siya sa stem cells na pinoproduce ng lymphocytes. Ang myeloid naman is nagre-refer siya ng stem cells na pinoproduce ng non-lymphocyte cells. So, pwede yung leukemia na matatawag natin siyang acute or chronic, like lymphoid, lymphocytic, ganyan. So, natatawag natin siya, acute na ba siya or chronic lang na types ng leukemia. So, it's naka-classified yun siya based sa times or symptoms. So, makikita natin kung nag-take siya ng time, pati yung symptoms niya, at saka yung mga nag-i-involve sa phases ng pagde-develop ng isang leukemia. So, matatawag natin siyang acute or chronic. So, ito na yung sinasabi ko. Types of leukemia. We have acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. Those are four na common sa leukemia. So, natatawag siyang acute lymphocytic leukemia. So, ano nga ba ang acute lymphocytic leukemia? So, ang acute lymphocytic leukemia is a type of cancer in the blood and bone marrow. So, the spongy tissues of the bones where blood cells are developed. So, ang acute lymphocytic naman, isa siyang type ng cancer sa blood and sa bone marrow. So, sa bone marrow, meron tayong spongy tissue which is doon ang isa inside ng bones natin na yon. So, doon natin kumbaga doon nagpo-produce ng blood cells, doon ginagawa ang blood cells sa katawan natin. So, words acute, sa acute lymphocytic leukemia, it comes from the fact that the disease progresses rapidly and create immature blood cells rather than matured ones. So, the word lymphocytic in an acute lymphocytic leukemia, it refers to the white blood cells are called lymphocytes, which HALL affects, which acute lymphocytic leukemia affects. So, acute lymphocytic leukemia is also known as acute lymphoblastic leukemia. So, ano yung acute lymphocytic leukemia? So, siyang type ng cancer in the blood sa bone marrow. So, kung saan sa bones natin, merong spongy tissues, doon nami-made ang blood. So, doon ginagawa yung blood. So, kapag acute nang sinabing nito, acute lymphocytic, my words na acute, it comes from the fact that yung disease na yon is nagpa-progress siya rapidly. madalas na siya and mabilis siya, rather nag-create ng mga immature blood cells. So kaya natatawag na siyang acute. So mas marami yung mga abnormal cells or immature blood cells rather than matured ones na yung nagagawa. So kaya natatawag siyang acute lymphocytic leukemia. So, refer siya sa blood cells na tinatawag nating lymphocytes. So, kaya naapektuhan ang acute lymphocytic leukemia. So, ang acute lymphocytic leukemia, pwede din siyang, known siya na tawagin na acute lymphoblastic leukemia. So, kapag ba nakakuha tayo ng acute lymphocytic leukemia, alam na natin. So, what are those symptoms? Symptoms and signs of acute lymphocytic leukemia may include bleeding from the gums, bone pain, fever, frequent infection, frequent severe nosebleeds. So, yun yung mga signs and symptoms na kapag yung isang tao is meron na siyang acute lymphocytic leukemia. So, first is nag-bleeding yung gums natin. So, masakit na yung katawan, nagkakaroon ng lagnat. So, tumataas yung lagnat niya. Meron din siyang frequent na madalas na siyang nagkaka-infection, which is yung mga examples of the ear infections. So, yung mga ganon. So, meron din tayong frequent and severe na nosebleeds. So, madalas din siyang nagdudugo yung ilong. So, madalas yun siya or paminsan-minsan may lumalabas na ganon. So, plus, nagkakaroon din ng lumps. Nagkakos yun dahil sa pagsuswollen ng lymph nodes. So, makita around the neck, meron yan, mag-lumps yan siya. So, sa mga armpit, abdomens, or sa groin area. So, next is a pale skin. So, kapag yung isang tao is positive of acute lymphocytic, meron din siyang pale skin. So, parang ano na yung skin niya. Nagiging pale yung skin ng isang tao, tapos short na sa breath. So, hindi na yung normal yung pag-breathe ng isang tao. Parang associated with the asthma, parang gano'n yun siya. So, parang nag-aagaw ng hangin. So, nagkakaroon din ng weaknesses. So, madali nang mapagod, feeling fatigue ang isang tao kapag positive of acute lymphocytic. So, and a general decrease in energy. So, nagkakaroon din ng hindi na malakas yung katawan. So, nagdi-decrease na yung energy ng isang tao. So, hindi na siya katulad ng dati na sobrang bilis or ganyan, tumakbo or something na ginagawa niya bilis, tapos hindi siya basta-basta napapagod. So, kapag meron na yan, so, it's a signs and symptoms that a person is a positive of acute lymphocytic leukemia. So, bakit ba nagkakaroon ng, ano yung mga causes kung bakit nagkakaroon tayo ng acute lymphocytic, bakit nag-occur yun? So, acute lymphocytic leukemia occurs when a bone marrow cells develop changes or mutations in a genetic material or DNA. So, kaya pala tayo nagkakaroon yun kasi nag-occur siya sa bone marrow natin. So, which is merong cells na dinedevelop doon is nagkakaroon ng changes in development na yon, which is yung genetic materials or DNA. So, ano ba itong DNA? Yung DNA contains instructions that tells a cells what to do. So, yun ang, kumbaga, yung function ng DNA sa katawan natin. Siya, kumbaga, yung nag-i-instruct sa cells kung ano dapat yung gagawin. So, dapat ba na sige-sige yung pag-produce or konti-konti lang. So, yung DNA na yun. Normally, yung DNA, sinasabihan niya yung cells na mag-growth, nagsiset din siya ng time, ng rate kung ilan yung dapat lang yung i-produce na normal cells. So, in acute lymphocytic leukemia, the mutations of the bone marrow cells continue growing and dividing. So, kapag ang tao is a positive of acute lymphocytic leukemia, asahan mo na yung yung cells niya yung cells niya is sige-sige lang yung pag-growth, continue, non-stop of growing and dividing. So, kaya nagkakaroon na ng acute lymphocytic leukemia ang isang tao. So, next, risk factor. Factor may increase the risk of acute lymphocytic leukemia includes previous cancer treatment, genetic disorder, exposure to radiation. So, meron tayong factor na yon, risk factor, kung bakit nagkakaroon ng acute lymphocytic leukemia. So, first, kapag meron kang previous cancer treatment, halimbawa, nagka-cancer ka dati, so, iba, hindi siya leukemia or another types ng kinds ng cancer. So, meron kang treatment na nadaanan doon. So, risk yun siya, isa siyang factor kung saan nag-i-increase na magkakaroon ka ng acute lymphocytic leukemia. So 'di ba nagkakaroon tayo ng mga chemotherapy, dumadaan tayo kasi meron tayong past history of the previous cancer treatment. So, merong radiation na nagaganap. So, isa siyang factor na risk na magkakaroon ng acute lymphocytic leukemia. So, next is the genetic disorder. So, eto, isa siyang genetic disorder is a certain genetic disorder such as halimbawa yung mga Down syndrome. So, bali na associated din siya sa nag-i-increase yung risk ng pagkakaroon ng acute lymphocytic leukemia kapag meron tayong mga genetic conditions. Next is the exposure to radiations. So, bakit isa siya sa mga risk factor? Because people extend very high level of radiation, so such as survivor of the nuclear reactions accidents, so may mga tao ganon, kaya nagkakaroon ng acute lymphocytic, nagiging risk factor siya, nag-i-increase yung risk factor sa pagkakaroon ng acute lymphocytic ang exposure to radiation. Halimbawa na lamang ng mga radtech, so merong na-associated with the radiation, so dapat careful sila when it comes to their work na pag-handle sa mga radiation kasi there's a risk factor na yun siya para magkaroon ng acute leukemia. So next is diagnosis. So, after you know na you have acute lymphocytic leukemia, kailangan mong magpa-diagnose. So, ano naman yon is kailangan is yung blood test, bone marrow test, imaging test, and spinal fluid test. Ano ba yung blood test? So, yung blood test, ini-reveal niya yung marami ka or konting white blood cells or red blood cells, enough ba yun yung mga naproproduce or sumobra ba yung platelets? So, tinitingnan dun siya sa blood test. Through blood test, nalalaman ang mga following na yon. So, sineshow din dito sa blood test kung meron bang presence ba siya ng blast cells or meron bang immature cells na hanaps or na-found nila sa bone marrow. Kaya nagkakaroon ng blood test. Next is a bone marrow test. So, during bone marrow test, aspiration and biopsy, a needle is used to remove the sample to bone marrow from hip bone or breastbone. So, ganon yung pagkuha, yung test, ang bone marrow test. So, ginagamitan siya ng needle. So, which is, kinukuha yun from the hip bone or breastbone ng isang tao para is-send yun siya sa lab para makita kung ano yung meron doon sa bone marrow mo rin. Kung excessive ba yung immature blood cells mo, yung pinoproduce ng bone marrow mo. So, next is imaging test. Ang imaging test is such an X-ray, a computerized tomography or CT scan, or an ultrasound may help determine whether the cancer is spread to the brain, spinal cord, or other parts of the body. So, kaya kasamang imaging test kasi tinitingnan siya in X-ray or CT scan ang katawan natin kung yung immature blood cells ba yun ano na siya, nag-spread na siya, pumupunta na ba siya sa brain, na-spread na siya sa brain, sa mga part ng spinal cord natin, kung meron na bang immature blood na dumadaloy doon. Kaya nagkakaroon ng imaging test. Lastly is the spinal fluid test. A lumbar puncture test, also called a spinal tap, that may be used to collect a sample of spinal fluids. So, doon, tinitingnan, kumbaga kinokollect kung saan nalalaman natin ang sample sa spinal fluid. Through a lumbar puncture lang yun siya, puncture test. So, yung fluid na yun, that's the fluid that surrounds the brain and spinal cord. So, the sample is tested to see whether the cancer cells have spread to the spinal fluid. So, kaya pala merong tayong spinal fluid test kasi kinukuha yun, kumbaga yung fluids na sa spinal natin. So, yun yung chine-check sa lab, sa laboratory para matingnan kung positive ba yung acute lymphocytic leukemia sa isang tao. So next, kapag may diagnosis, we have also a treatment. In general, treatment for acute lymphocytic leukemia falls into separate phases. So madami tayong pagpipilian na kumbaga step-by-step treatment na ginagawa ng mga doktor kapag ang isang tao is positive of leukemia. So, meron tayo induction therapy, consolidation therapy, maintenance therapy, preventive treatment to the spinal cord. So, ito yung mga treatment na pwedeng gamitin kapag ang isang tao is positive of acute lymphocytic leukemia. So, first is the induction therapy. So, the purpose of the first phase is to treat the treatment to kill most of the leukemia cells in the blood and bone marrow and to create normal blood cell production. So, kaya ginagawa yung induction therapy, yung purpose niya is iti-treat niya yung mga yung cells sa blood or sa bone marrow, pinapatay niya. So, pinapatay niya yung leukemia cells sa blood and the bone marrow. And nire-restore niya, binabago niya yung normal blood cell production. So, yun, kaya nagkakaroon ng induction therapy. So, next is the maintenance therapy. Maintenance therapy, the third phase of treatment, a consolidation therapy. So, ang consolidation therapy is also called post-remission therapy. This phase of treatment is aimed to destroying any remaining leukemia in the body. So, yung consolidation therapy, yung aims niya naman or yung purpose niya kung bakit ginagawa sa isang tao is kapag merong natirang mga leukemia, yung immature cells sa katawan, so siya yung bahala naman pumatay sa mga remaining na yon. Yun yung aim ng consolidation. Isa remission therapy. So, the next one is the maintenance therapy. So, this is the third phase of the treatment, prevent leukemia cells for regrowing. The treatment used in this stage are usually given at much lower doses of over a long period of time, often years. So, ang maintenance therapy naman is siyang the third phase siya ng treatment. So, dito, yung purpose niya is prevent niya yung leukemia cells na magre-growing. So, hindi yung mga cells doon is hindi siya basta-basta nagdi-divide or nag-grow bigla-bigla. It's because ginagawa ng maintenance therapy is yung i-stop yung regrowing niya. So, yun naman yung aims ng maintenance therapy. The next one is preventive treatment to the spinal cord. So, during each phase of treatment, people with an acute lymphocytic leukemia may receive additional treatment to kill leukemia cells located in the central nervous system. So, in this type of treatment, chemotherapy drugs are often injected directly into the fluid that covers the spinal cord. So, dito naman, sa fourth na to, is prevent niya, siya bali yung treatment for the spinal cord. So, kapag acute lymphocytic leukemia na positive lymphocytic leukemia ang isang tao, so, asahan mo na there are immature cells na baga umiikot na sa spinal cord area or sa mga brain, ganyan. So, dito ginagawa naman ng preventive treatment to the spinal cord. Yung aims nila naman is pinapatay din nila yung kumbaga kinikill din nila yung mga cells na na-located halimbawa sa central nervous system. So, sila naman yung kumbaga bahala doon para ma-stop yung regrowing or dividing or something na ginagawa ng cells. So, usually, ini-injectan nila ng chemotherapy drug. So, drugs, ini-injectan nila yon directly into the fluids ng spinal cord. So, para ma-prevent nila yung pag-regrowing or dividing or ng immature cells doon or yung leukemia sa area ng spinal or saan man nakalocate. So, sila yung bahala. So, meron din tayong treatment. So, depending on the situation, the phases of treatment for the acute lymphocytic leukemia can span 2 to 3 years. So, pwede yun siya na-i-span yung pagtitreat ng acute lymphocytic leukemia. So, meron din tayong treatment. Include dito yung chemotherapy, targeted therapy, radiation therapy, and bone marrow transplants. So, ano ba to yung chemotherapy? So, chemotherapy which uses drug to kill cancer cells. It is typically used as an induction therapy for children and adults with an acute lymphocytic leukemia. Chemotherapy drugs can also be used in consolidation and maintenance phases. So, pwede pala yung chemotherapy na yon, yung drugs na yon, ginagamit yun siya, katulad ng sinabi ko kanina, yung mga induction therapy, yung mga consolidation therapy or maintenance therapy, yung mga phases na yon. So, pwede siyang ginagamit yung chemotherapy na yun, yung drugs na yun to kill those leukemia cells sa katawan natin. So, kaya binibigyan ng chemotherapy drugs, yun na, yung mga function niya para i-kill yung cancer cells, yung mga immature cells sa katawan ng isang tao. So, next is the targeted therapy. Targeted therapy drug treatment focus on specific abnormalities present within the cancer cells. So, by blocking these abnormalities, targeted drug treatment can cause cancer cells to die. So, kaya nagkakaroon tayo ng ginagamitan din ng targeted therapy. It's yung bale yung aims nila, yung focuses nila is to in-specific nila kung ano yung abnormalities na napapresent sa isang cancer cells. So, yun naman yung kumbaga pinupuntahan nila, binablock nila yung abnormalities doon. So, it is also a drug treatment. Yung ano na to, yung targeted therapy na to. So, bale, yun yung drugs na yun is nagtitreat yun siya para ma-stop or mapatay yung cancer cells ng isang tao. So, next is radiation therapy. So, ang radiation therapy, it uses high-powered beams such as an X-rays or protons to kill cancer cells. If the cancer cells is spread to the central nervous systems, your doctor may recommend radiation therapy. So, kapag naman alaman ng doctors nyo na sobrang yung acute lymphocytic leukemia nyo is umabot na hanggang central nervous system ninyo, hanggang hanggang sa mga spinal cord niyo. So, bale, yung binibigay ng doctor na treatment is yung radiation therapy. So, halimbawa, yung radiation therapy is yung mga X-ray, yung mga protons, yung mga shaded with mga high-powered beams. So, associated siya doon. Kaya binibigay ng doctor yung treatment na yon is to kill also the cells, cancer cells sa katawan. So, next is the bone marrow transplant. So, a bone marrow transplant, also known as the stem cell transplant, may be used a consolidation therapy for treating it, relapse it, or occurs. These procedures allow someone with leukemia to establish healthy bone marrow by replacing leukemia bone marrow with leukemia-free marrow from a healthy person. So when we say bone marrow transplant, so surgery to, so pinapalitan yung bone marrow ng isang tao, which is free siya from those cancer cells. So maganda yung mga production, yung mga cells niya pinoprovide ng bone marrow. So hindi katulad ng isang leukemia, positive of leukemia, yung isang tao is yung napoproduce ng bone marrow nila is mga immature blood, yung mga immature blood cells. So eto naman, at this point, binibigay nila yon, tinatransplant nila papunta sa may sakit na yon, yung bone marrow, para bale yun yung magiging panibagong bone marrow ng isang tao, which is free siya, healthy yung pinagkuhaan nito. So yun lang yung treatment na pinoprovide or binibigay ng doctor if meron kang acute lymphocytic leukemia. So for the treatment for the older adults, so older adults such as those older than 65 tend to experience more complications from treatment. Kasi bakit? Kapag yung isang tao matanda na, marami yung complication na nangyayari sa katawan niya. Hindi siya katulad ng mga yung mga teenager, yung mga mababa lamang yung age. So hindi siya marami yung complication, hindi tulad ng isang 65 older na tao. So maraming complication kapag binibigyan siya ng treatment. It's either hindi na-absorb ng katawan niya kapag binigyan siya ng radiation therapy, bawal sa kanya. Merong complication na meron siyang sakit which is magiging complication doon. So, kaya an older adult generally have a worse prognosis than children who are treated for acute lymphocytic leukemia. So, that's why nagiging more complication yung mga matatanda kesa sa mga bata na merong acute lymphocytic leukemia. So, the next kinds of types of leukemia cancer, which is the chronic lymphocytic leukemia or the CLL. It is a type of cancer in the blood and the bone marrow. So, the spongy tissues inside the bones where blood cells are made. So, same. Yung chronic naman ito, isa siyang type din ng cancer in the blood, sa bone marrow. So, meron tayong spongy tissue inside the bones wherein yung blood cells natin doon ginagawa. So, meron kumbagang immature cells na naggagawa or merong rapidly na growing of the mature cells kaya nagkakaroon ng chronic lymphocytic leukemia. So, the term chronic, it is chronic lymphocytic leukemia comes from the fact that this leukemia typically progresses more slowly than the other types of leukemia. The term lymphocytic in a chronic lymphocytic leukemia comes from the cells affected by the disease, a group of white blood cells called lymphocytes which may help your body fight infection. So, yung term na chronic naman is kumbaga hindi siya katulad ng acute or katulad ng ibang term na mabilis. So, yung chronic is slowly lang siya, slowly types ng leukemia. So, yung term na lymphocyte, yun yung kung saan yung cells is affected by the disease. So, ito yung kumbaga ang group ng white blood cells na tinatawag, which is yung lymphocyte, white blood cells, WBC. So tinatawag siyang lymphocytes, also called lymphocytes. So, yun yung WBC. It's nagtutulong siya sa katawan natin to help body fight infection. So, kung meron mang pumapasok na panibagong, bacteria or viruses. So, yung WBC natin, yung tumutulong sa katawan natin or yung nagpa-fight against those bacteria or virus na pumapasok. Kaya, it's a big, talaga yung WBC sa katawan natin. So, kapag nagkakaroon tayo ng chronic lymphocytic leukemia, we have also signs and symptoms develop that may include. So, first is getting infections, often anemia, persistent tiredness, shortness of breath and pale skin, bleeding and breathing more easily than normal, high temperature, night sweats, swollen glands in the neck, armpit, or groin. So yun. And also the last is the swelling and discomfort in your tummy and unintentional weight loss. So kaya tayo, yun yung mga sign and symptoms kapag yung isang tao is positive of chronic lymphocytic leukemia. So, nagkakaroon siya ng infection. So, madalas yun siya. Nagkakaroon ng mga infections sa katawan. So, next is kapag meron siyang anemia. Anemia, which is yung RBC niya, mababa. So, natatawag na siyang hindi na yung sapat yung nabibigay ng bone marrow niya ng RBC niya, yung RBC niya. So natawag na siyang anemia. So meron anemia yung isang tao. So meron din siyang persistent tiredness. So madalas na siyang napapagod kahit anong gawin niya, kahit simple things lang yung gagawin, madaling mapagod. So meron din siyang shortness of breath. So madali di nag-aagaw siya, yung tawag nito, hangin, yung hindi maganda yung takbo ng breathing airways niya. So associated with the asthma. So parang ganun yun siya. And pale skin. So nagiging pale yung look ng isang tao or yung skin ng isang tao. Also nagbi-bleeding din siya. Nagiging madalas yung mga bruise niya sa katawan niya. Magiging siya, parang more bruising siya kaysa sa normal na tao. So, parang madali lang siyang nasusugatan, parang ganun lang. So, nagbi-bleed agad yun siya. So, at saka nagiging high temperature din yung isang tao kapag positive of acute siya ay chronic lymphocytic. So, nagkakaroon siya ng night sweats. So, napapansin niyo talaga yan. Nagiging swollen din yung mga glands niya. So, sa neck area, sa mga armpit, sa groin. So, nagiging swollen yun siya. Kasi yun yung mga signs and symptoms kung bakit kung meron sakit yung isang tao na chronic. So, swelling and discomfort in your tummy. So, yun isang factor din siya kung bakit meron. Nag-swell din siya, tapos hindi mapakali, kumbaga, yung isang tao merong discomfort sa tummy area. So, meron din siyang unintentional weight loss. So, so you can observe, hindi na siya parang mataba or something ganon, pumapayat ng isang tao kapag meron siyang chronic lymphocytic leukemia. So, the causes is the doctors are not certain what starts the process that caused the chronic lymphocytic leukemia. So, what's known is that something happens, changes or mutation in the DNA of blood-producing cells. So, same din siya, parang acute din siya kanina. Merong nagkakaroon ng changes mutations sa DNA, which is yung DNA na yon yung nag-i-instruct sa cells natin kung ano dapat yung gagawin. So, meron, same din siya yung causes niya. Meron din siyang abnormalities, kumbaga, yung DNA niya. So, yung, which is yung nag-instruct na magproduce ng mga cells sa katawan. So next is the risk factor. Factor that may increase the risk of chronic lymphocytic leukemia include your age, your race, family history, and blood bone marrow cancer, exposure to chemicals. So those are the risk factors na merong chronic nag-increase yung risk ng chronic lymphocytic leukemia. So first is pagiging yung mga age natin, yung race, kung meron ba tayong family history na meron silang positive sila ng chronic or acute or something na sa leukemia. So, kung meron ba silang history na nagkaroon sila ng bone marrow transplant, yung history about blood nila or it's not good to their health. So, next is exposure to chemicals. So, kapag yung isang tao, nagiging risk factor din kapag yung isang tao is madalas na na-expose sila sa mga chemicals like X-ray na yon, yung mga protons, which is yung chemical beams na na-expose yung isang tao. So, it's a risk factor yun siya, kaya nagkakaroon ng chronic lymphocytic leukemia. Next is the complications. So, chronic lymphocytic leukemia cause complications to the frequent infection, switch or more aggressive form of cancer, increase of other cancer or immune system problems. So, yun yung nagiging complication niya kapag madalas nang nagiging merong infections sa katawan. So, nagiging aggressive yung cancer nila. Mabilis yung dividing, yung growing, yung fast ng ng immature cells nila. So, nagiging risk din yung nag-i-increase din yung risk ng mga iba't ibang sakit sa katawan or yung kung may cancer sa anuman. So, nagiging risk yun, nag-i-increase din yung possibilities na magkaroon ka ng ibang cancer din. So, immune system problems. So, humihina yung immune system ng isang tao. So, yun yung complication ng sakit na to. Parang nanghihina na yung isang tao kapag may chronic lymphocytic leukemia. So, yung next is the treatment. The treatment, your options for chronic lymphocytic leukemia depends on the several factors, such as the stage of your cancer, whether you're experiencing signs and symptoms, your overall health, and your preference. So, depende yung treatment, like acute kanina, depende din yung sa chronic na to, kung ano yung ibibigay na treatment sa'yo ng doctor. So, it's depends kung yung naranasan mo yung sign and symptoms, half lang doon, yung kung anong stage ka na, stage 1, 2, 3, ganyan, ng cancer, and pati yung overall health or lifestyle at ng mga preference. So, doon titingnan kung ano ba dapat yung ibigay na treatment sa isang tao. So, the following treatment are those chemotherapy, targeted drug therapy, immunotherapy, bone marrow transplant. Same with the acute kanina. So, katulad din siya ng sinabi ko kanina, like sa acute lymphocytic leukemia, so yung chemotherapy. So, yung chemotherapy, ito sa drug na kinikil yung cancer cells sa katawan. So, like kanina, targeted drug. So, ito naman, in-specific niya yung abnormalities sa cancer cells na yon. So, binablock niya yung abnormalities na yon. Kaya, yun yung binibigay na drug. So, immunotherapy. So, it's from sa immune naman, so ginagawa din siya, binibigay din ng doktor sa isang tao kapag meron siyang chronic. So, next is same with kanina din, bone marrow transplant, same with the acute. So, ganun din yung gagawin ng doktor or yung ibibigay treatment ng doktor. Yung bone marrow transplant is kukunin sa ibang tao kung saan free siya, healthy yung bone marrow ng isang tao. So, ilalagay siya sa alisin yung bone marrow ng isang tao which is hindi siya healthy. So, papalitan yun siya para maging healthy yung produce ng bone marrow ng isang tao. So, yung mga cells na ipoproduce, ang white blood cells, red blood cells na ipoproduce ng bone marrow, which is healthy yun siya. Maganda na rin yung takbo nito sa katawan ng isang tao. So, the next is the acute and the chronic myeloid. So, Tan will be the one who tackle about this. That's all. Thank you.
So, my reports about the acute myeloid leukemia and the chronic myeloid leukemia. So, first, the acute myeloid leukemia results from the defect in the hematopoietic stem cell that differentiates into all the myeloid cells. So, ito yung mga monocytes, the granulocytes, and the erythrocytes and platelets. So, ano nga ba yung monocytes? So, yung monocytes, ito yung type of leukocyte or the white blood cell. Ito yung largest type of leukocyte and can be differentiated into macrophage and conventional dendritic cells. Then next is granulocyte. So yung granulocytes is a white blood cell that has small granules. These granules contains proteins, specific types of granulocytes. Ito yung mga neutrophils, eosinophils, and basophils. So, granulocytes, specifically neutrophils, tinutulungan nito katawan against bacterial infection. Then, the red blood cells, also known the erythrocytes. So, deliver oxygen to the tissues in your body. Then, oxygen turns into energy and your tissues release carbon dioxide. And your red blood cells also transport dioxide to your lungs for you to exhale. Then, next is the platelets or thrombocytes. So, are small colorless cell fragments in our body that form clot and tumutulong or nagpe-prevent ng bleeding. Then, next one is the clinical manifestations. So, the AML or the acute myeloid leukemia develops without warning with symptoms typically occurring over a period of weeks. And sign of symptoms result from insufficient production of normal blood cells. So, typical average production ng normal blood cells umabot ng 200 billion red cells per day and 10 billion white cells per day, and 400 billion platelets per day. Then next, fever and infection result from neutropenia or low neutrophil count, weakness and fatigue, so panghihina, and dyspnea or exertion, and pallor from anemia, and bleeding tendencies from thrombocytopenia. So yung thrombocytopenia, condition in which you have the nababa yung blood platelet count ng isang tao. Then assessment and diagnostic findings. The complete blood count or the CBC shows the release in both erythrocytes and platelets, although the total leukocyte count can be low, normal or high. The percentage of normal cells is usually vastly decreased. A bone marrow analysis shows an excess more than 20% of immature leukocytes called the blast cells. This is the hallmark of the diagnosis. So, yung erythrocytes, a type of blood cell that is kung saan or made in the bone marrow and found in the blood cells. Then the platelets. Platelets are pieces of very large cells in the bone marrow called the megakaryocytes. So, they help form blood clot. So, nagpo-form ng blood clot, and also ini-stop yung kung mayroong bleeding, and also tinutulungan din ito yung wounds na mag-heal. Then the medical management, despite advance in understanding of the biology of the acute myeloid leukemia or the AML, substantive advances in treatment response rates and survival rates have not occurred for decades, with the exception of the advance made in treating APL, or even for patients with the AMLs subtypes that have not benefit from the significant advance in treatment, a cure is still possible. The overall objective of treatment is to achieve complete remission, in which there is no evidence of residual leukemia in the bone marrow. Then next is the complication. So sa complication, include dito yung bleeding and infection, which is a major causes ng death. And the risk of bleeding correlates with the level and duration of platelet deficiency. So kakaroon ng kulang or mababang platelet. So also tinatawag din itong thrombocytopenia. Then next one is the chronic myeloid leukemia, or the CML, arises from the mutation in the myeloid stem cell. Normal myeloid cells continue to produce, but there is pathologic increase in the production of forms of blast cells. So yung blast cell, ito yung mga abnormal or immature white blood cells. Therefore, a wide spectrum of cells types exist in the blood, from the blast forms to mature neutrophils. So yung bone marrow ng adult nagpo-produce ng about 100 billion of neutrophils daily. So it takes about 1 week to form the mature neutrophil from the precursor cell in the marrow. The next is the clinical manifestation. The clinical picture of CML varies. Patient may be asymptomatic, and leukocytosis is detected by the CBC performed for some other reason. So yung leukocytosis, common to sa mga acute ill patients. It occurs in response to a wide variety of conditions. Ito yung mga bacterial, fungal, or parasitic infection, cancer, hemorrhage, and exposure to certain medication or chemicals, including the steroids. Then yung asymptomatic naman, showing no symptoms of disease. Then medical management. Yung medical management is advanced signals within the leukemia cells that express the BCR or the ABL protein, thus preventing a series of chemical reactions that cause the cell to grow and divide. So yung BCR or ABL, makikita ito sa mga patient na mayroong chronic myelogenous leukemia or the CML, and sa mga patient na mayroong lymphoblastic leukemia, and or sa mga acute myelogenous leukemia or the AML. So next is the nursing management though. So advance in treatment of CML have changed the trajectory of the disease from the life-threatening and likely fatal to being chronic illness. So chronic illness means malalang sakit. However, nurses must understand the effectiveness of the drugs used to treat the CML is based on the patient's ability to adhere to prescribed medication regimen and on the appropriate monitoring of the treatment.
Hello everyone, I'm Ulidalos Nahar J. My topic is about thyroid gland. So thyroid gland is a butterfly shape composed of two lobes, the left and the right. Left and right connected by a narrow tissue band called an isthmus. The thyroid is near to the front of the neck, lying against the around front of the larynx and the trachea. The thyroid cartilage are cricoid cartilage lie just above the gland before the Adam's apple. The isthmus extend from the second to third rings of the trachea, with the uppermost part of the lobes extended to the uppermost part of the lobes extended to the thyroid cartilage, and the lowermost around the 4 to 6 tracheal rings. Next, we have the blood, lymph, and nerve supply. The thyroid is supplied with arterial blood from the superior thyroid artery, a branch of the external carotid artery, and the inferior artery, thyroid artery, a branch of the tricocervical trunk. And sometimes, by an anatomical variant, the thyroid artery, which has a variable origin. So we have the superior thyroid artery split into the anterior and posterior branches supplying the thyroid. The inferior thyroid artery splits to superior to next is the arteries joined together behind the outer part of the thyroid lobes. So next is the variation. There are many variant size and shape of the thyroid gland and the position of the indented parathyroid glands. So first we have the third lobe present called the pyramidal lobe. With present, this lobe often stretches up the high point from the thyroid thymus and may be one of the several divided lobes. The presence of this lobe range is reported studies from 18.3% to 44.6%. It was shown to more often arise from the left side and occasional separated. The pyramidal lobe is also known as Lalotis pyramid. The pyramidal lobe is a remnant of the thyroglossal duct, which usually weighs away during the thyroid gland's descent. Small accessory thyroid glands or the thyroglossal duct from the foramen cecum of the tongue to the position of the thyroid in the adult. Next is the development of the thyroid gland. In the development of the embryo at 3 to 4 weeks at gestational age, the thyroid gland appears on an epithelial proliferation in the floor of the pharynx at the base of the tongue between the tuberculum inferior and the copula lingual. The copula soon becomes covered over by the hypopharyngeal eminence at a point later indicated by the foramen cecum. Function of thyroid or the thyroid system. Thyroid hormones T3 and T4 have a number of metabolic, cardiovascular, and developmental effects of the body. The production is stimulated by release of thyroid stimulating hormone or the TSH, which is turn depends on release of thyrotropin releasing hormone or the TRH. Every downstream hormone has a negative feedback and decreases the level of the hormone that stimulates its release. The thyroid hormones have wide range of effect of the human body. These include the metabolic, cardiovascular, and the developmental.
Assalamualaikum. My name is Aleng Tonyo. So my topic is stomach. So stomach is a hollow organ or container that holds food while it is being mixed with the stomach enzymes. So these enzymes continue that process of breaking down food into a usable form. So cell in the lining of your stomach secrete as a strong acid and powerful enzymes that are responsible for the breakdown process. So stomach is a hollow organ or a container na naghold ng pagkakain habang ito na namimix or nahahalo naghahalo ang pagkain na mula sa enzyme. So ang enzyme na ito ay nagpapatuloy sa process to breaking down food into a usable form into a usable. So ang cells lining of your stomach, it is lumalabas na isang malakas na acid ang powerful enzyme na responsible para sa process. So causes, stomach is your stomach is a muscular organ that digests food. It is a part of gastrointestinal tract. So when your stomach to receive the food, it has contract and produce acid and enzyme that break down into the food. So when your stomach has broken down food, it has a process. It is to your small intestine. So for the causes of stomach, Causes of the stomach problems may be caused by condition of the digestive tract, including the bacteria, parasitic or viral infection of the gastrointestinal tract, celiac disease, or severed sensitive to gluten from the wheat and other grains that causes intestinal damage. Damage ang yung intestinal. So diverticulitis to inflammation of abnormal pocket in the colon. So sign and symptoms include the abdominal, yung magkasakit ang tiyan natin, nausea, yung nahihilo, vomiting, nagsusuka, inability to drink fluids, feeling hungry soon after eating, fatigue, and weight loss, black or tarry stool. So prevention is if would like to prevent belly aches. Here are some good tips to follow. Don't overeat. Huwag tayo overeating. Eat favor rich foods. Katulad ng vegetable or fruits. So your bowel movement, regular drink lots of fluids, especially water. So for the transmission is a virus that cause gastroenteritis are spread close contact with the infected people, such as yung nagsishare tayo ng pagkain or mga kagamitan na paghawak sa mga contaminated sa mga ibabaw or bagay na eating to contaminated food also can causes norovirus. So the next is treatment include the especially drinking water, avoiding lying down, gigger, mint, taking a warm bath or using heating bag, broth diet, avoiding smoking and drinking alcohol, yung huwag tayo mag-smoke sobra, then alcohol, lalo na alcohol like tanduay, or avoiding too difficult to digest foods. So abdominal pain diagnosis. So for the lower abdomen, possibly appendicitis, ectopic pregnancy, diverticulitis, or inflammation of the fallopian tubes. Also for the upper abdomen, possibly gastroesophageal reflux, gallstones, pancreatitis, or heart attack. So for the medicine for best for the stomach pain, so over-the-counter medication for the cramping from diarrhea. So that is for the medicine that have loperamide or Imodium or bismuth, subsalicylate or copictate or Pepto-Bismol, so might make you feel better. For the other types of pain, acetaminophen or aspirin, free antacid liquid, Panadol, Tylenol, and might be helpful. So nakakatulong sa atin tiyan na kung magkasakit or kung magkaroon tayo ng stomach pain. So that's all